So what is SIRVA, or shoulder injury related to vaccine administration? SIRVA occurs when, during an intramuscular vaccination in your shoulder, the injection causes inflammation of your shoulder joints. So tendons, the ligaments, the bursa within your shoulder become inflamed. The diagnoses we see associated with SIRVA quite often are bursitis, tendonitis, rotator cuff injuries, frozen shoulder, or adhesive capsulitis. So when I do consultations with people who think they may have a SIRVA injury, I'm not able to diagnose them. I'm not a doctor. Based on my experience, helping people with this and filing claims for them in the Vaccine Injury Compensation Program, there are certain symptoms that I look for in a SIRVA case. That includes pain, in your shoulder within 48 hours of the vaccination. It's probably the most important symptom. We call it onset, because we have to prove in this program that your shoulder pain, started within that 48 hours of the vaccination. And the way we prove that is through, medical records or medical documentation. Hopefully you will have gone to the doctor and reported your injury and referred to the vaccination, memorialized when your symptoms started. In addition to pain, what we typically see eventually in these cases also is reduced range of motion. That's another important characteristic of SIRVA, because, again, the diagnoses we see, like bursitis or tendonitis or a rotator cuff injury, quite often involve, a reduction in your range of motion. Another common symptom we see is diminished strength. So, obviously, holding or carrying, everyday items or a gallon of milk, things like that, can become quite difficult. So aside from a reduction in your range of motion, we see some functional limitations as well. So you may not have the same strength in that arm or shoulder. Things like household chores or daily activities may become challenging or difficult. Things I hear a lot are difficulty falling asleep or staying asleep, reaching up into your upper cabinets, reaching for your seatbelt, putting on a jacket or you're getting dressed, even, grooming, in the shower or you're brushing your hair. All these things, can become more challenging or difficult with a SIRVA injury. So there's no, rhyme or reason to how long your SIRVA symptoms may last. Everybody's different. Every case is different. And, depending on the type of treatment you get, your symptoms may persist for a short duration or for a long duration. It may even involve surgery. So most important thing, of course, is, you get to the doctor and, to find the right course of treatment for you. There is a threshold of 6 months that's important in the context of the Vaccine Injury Compensation Program, because that's called the severity requirement. We need to show that your symptoms of SIRVA persisted for at least 6 months. Otherwise, you're not eligible for compensation. So in that regard, a lot of these SIRVA injuries do persist for at least that long, at least have some sort of mild symptoms even towards the end of 6 months. Regardless, that's an important detail to remember. Oh, if you'd like to learn more about SIRVA, you can text us at 312-847-2428. You can text us SIRVA, and we'll ship you a copy of our book all about SIRVA. We explain, more about the injury and how we get compensation for our clients. If you believe that you may have been injured by a vaccination, I would encourage you to contact us at 312-578-9501 for a free consultation.